cook, we dey prepare a very delicious and healthy dish as we dey focus on Chasl at 50. We go look at where dem start, who side dem dey now, and wetin na the future of this great institution. So una join we as we dey cook this cook together. Me wey na the chef cook for today, me name na Lamsi John. And I go like follow una stay with me for the next 1 hour as una sef go dey blow the fire over there with the comments them, so that we go cook this cook together and we go do am quick. So for cook this Pehmahun today, not to me one day now, so I dey with Madam Gifty Florence Masakoy, when are the executive director of Chasl, as Nanga for help me with the menu for today on cook. For today cook, now what I will go buy. We go far for go buy for this cook here so today. And the Pehmahun they use na lonsali komo. So this at this time we dey light the fire, wash the pot, and put the pot over fire, make the water begin for boil. So Madam Florence, as the water dey on fire now, don't put her for let it boil. We go like follow you tell we waiting Chasl dey about.
Thank you very much, Madam John. Viewers and listeners, on a good evening. Of course, Christian Health Association, we in short we call Chasl, done 50 years ago, and because of 50-year passing auto picking again, and we say a golden jubilee, means say it don't go through good times and bad times. It don't go table side or reach. If it possible, say for don't get PhD by now, and even be a consultant. So Chasl don't go through thick and thin. And this year, because we done 50, the theme for the celebration now, 50 years of compassionate care and community impact. Because Chasl don't impact so much. But as you say, we don't come on market scarf, we don't buy. Lots of people to buy. They really do for this cook and the number of people the way it go serve. Chasl, waiting we bring come about. We know say ideally some ideas they come just from one person. But later on, ideas they come together where they get 2-3 people then somebody will get a vision say, no, if we meet every day no more, we eat, we drink, we scatter, that's not go waiting. But I'll do something we go like make with it together. So now be the same kind of thing happen where the Christian Health Association form. You get church denominations then, we get them member health facilities then. Because not say the churches them in those years and up till now, most of them get schools. You see, say even some when a Muslim, you go tell you say I go Catholic school or I go Christian school. So then go through schools and at the end of them be saying another basic amenity and forget well body place. So hospitals then be there, but everybody don't they act individually on their own. So then the necessary say if them missionaries, and because most of the time the one they can help with, just as like for example the Catholic Church tell you say now for be self-reliance, because them be the way everything now it's man be the kiwi. So them be can now and say no, let we self try for land for we self. In case them people here go to man they knock again, now just the same like that. And as much as we they get missionaries and doctors and they come, nurses and they come, or other well body workman and they come for do work here, then we get for return back, and when they return back, how we go sustain them. So, and we get the different denominations. We get Anglican, we get Baptist, we get Adventist, we get Catholic, Methodist, as the case may be, up to 10 denominations. So then the necessary say, therefore come together, form and get one word, so that then go get an umbrella where they all go come under. So if not anything self to man, then go able to talk for them. If not for go bigger self to government, then go get somebody with a mouthpiece for them. And then go able for the coordinates then care. So because they know they go in underserved communities, who say governments not able for each other. If even government they reach they possibly in or do. Sometimes at one hospital there, we don't see Sierra Leone direct today. How every day with the increase in we number. So now that in short, I would say now the reason we make. So them big people and them missionaries they will becoming our doctors, when our well body workman them, maybe they work now them faith-based hospital and clinic there. So them be see unnecessary for say the need for come together so that they go able for support we people in Sierra Leone and champion the idea for create this umbrella organization when at the Christian Health Association for SECA, may they ensure quality, may they ensure equity, that wherever you go, you long, you short, you black, you white, you forget access. So that make the vision even to say a Sierra Leone where everyone can access good quality healthcare services. So then share that goal say for improved coordination among the other health facilities then for let get standardized care and also for strengthening them. Let A not they do this, then B they do the other. If they all say na eye clinic, they for do offer the same thing. If they say na maternal na mama and picking business, then they look at them for do the same kind thing. Then go do trainings them together. Or if this Baptist get, you go able to tell Catholics say I don't get to they like help you and all of them, and they so they represent the Christian. And so the Christian Health Association, the faith-based, now their owner, women say the church leaders them, and the secretariat just there as the day-to-day operational body when I in the liaise between the church leaders, between the member health facilities, between the donors, for go bigger, so waiting at the need, where Baptist hospital need, waiting at the need, where Methodist hospital need, or the clinics they need, or which community, because there are times even though get a member facilities here, yet they go beyond the facilities, but they even go into the communities and see what could be done. So if I could say in brief, I think so don't pick the fish, otherwise the classes.
Yes, yeah. So you mentioned something about different people coming together. So for the sake of listeners out there, what are exactly them people there? So when are the partners then?
Well, the partners them, then we don't deal with so many partners, but we could talk to the church denominations, as I say, Christian Health Association. In other countries, then just call and chat. The SL just can because of the country, but the overall name like Christian Health Associations. If you go Liberia, I get Chasl, Christian Health Associations of Liberia, Christian Health Association of Ghana, like that. So the last acronym, they follow the name. So we get a platform where they call ACHAP, where they harmonize all the Christian health associations in Africa. So that's now one key player where they support Chasl. But as I say, now the church leaders them now their own Chasl. So whatever decision will they take, when you look at the organogram, the hierarchy, you find out say whatever they do now, the church leaders if one take any decision today for Baptist hospital, we're not gonna say until the leader for Baptist say yes, so, or we want somebody for can represent them. Now the leader get for agree, right? Say I recommend so person because of so knowledge we get for let represent me na the board. This na in criteria or this na in CV. So now the church leaders then we dey behind for support because then are the faith actors. We know so anything after that pulpit stop. Whatever challenging, it will be easier for we. So then key players here from Methodist, from UBC, from Lutheran, from Adventist, from Catholic, because even Methodist, we get Methodist Church Sierra Leone, you get United Methodist Church, we get Pentecostal, all of them one day also come together. And then are the key players. But when it comes to supporters, one of the key supports now the Ministry of Health. Because the Ministry of Health, we don't put on under, we will not forget sit on place. So the Ministry of Health now one key person where we appreciate because even whenever we go to about 30% of we coverage na Sierra Leone, now because of them, and they don't even help with that. If for any reason, sorry, ask people and say they want help Chasl for reach to be different member facilities, then the Ministry of Health don't help we forget duty waiver. So if something and they can once it relates to well body business, we they go and get duty waiver for collect that particular container day or whatever we can weigh they in line with member facilities. We don't also get USAID, we don't they help. We don't get IMA, we don't get Restoring Vision right now, where we they give glasses to people them we need them, whether na schools, whether na the hospitals them. So at times the hospital not even able to utilize all the number of glasses when they give. So they can go out now in communities then see how then they distribute them. So we get different one. And presently we get key partners that will they work with us at now because of the kind projects they will get. We get Bread for the World when we key donor partner with they from Germany. And we like most of the staff themselves now Bread for the World responsible for pay them. Then we get Action Media and Bread for the World presently, they undertake a particular project where they call antimicrobial resistance where they cover 14 hospitals them. Why antimicrobial resistance? Because we don't find out say, or studies don't even prove say, in years to come by 2030 many people not go respond to some treatments, antibiotics for example, because when somebody sick, he get cold, e like na virus cause that cold. If you say now where you go over the counter and buy amoxicillin or you go buy ampiclox, so time get for reach where that medicine no longer work, and because they no longer work, you dey spend more money. So at the end of the day, person get for they do culture insensitivity, then they know whose tumbu cause this problem, whose medicine this tumbu don't tie up or we go work pan. So that now one way bread for the world don't take way with the under project day where they work na 14 hospital. Another one na action media in concentrate from mama and picking business. So you find out say bo under Caritas, they get school of midwifery, but where then self they train midwives and then do the you. Whereas we na Chasl self get 15 communities where then one and they say not to even Chasl community, as I say, we dey work into the communities where na Moyamba or na the south again, where action media they look at this working into 15 communities. Then as I say, we get restoring vision. Then we get DFAM now one strength in how we go get medicines, quality medicines. Because if we say we get them member facilities, one of the key things we go make them able work now we then get quality, safe, effective medicine. You know, say when you take Panadol, when you say Panadol, when you take you know, say as you take it will be effective before well, you know, go take medicine when not chop and all of them one and day. Then recently we don't even sign MOU with Rainbow Initiative, when they say we work with more women them and all. We get so much Latter-day Saints, we still in we get potential partners and we presently get the one they work with and the one they will be done work with. But we still deal with them, World Vision, CRS, World Hope, as the case may be.
All right, so now we do a very good job. So, and 50 years old, not to 5 days, now a very long time, and it's still going on. That means now so many efforts and I don't put together, so many work for making reach this 50 years. So we go like for waiting prompt the establishment of Chasl. Like whose gap they found that they made it try for filling.
So thank you very much. As I stated earlier on, one of the key gap that they don't want to let people they independently, but come together as a team. Let we get an umbrella organization. Just like you say, we all dey book fields. This day na this year, but then go see and say, well, even though they na book people, get book fields community. So at the end of the day, this community, when it comes to so this now we aid man. So that na be one reason that if one go na ministry now once for let them send well body work man for where they still say Baptist and go say, hey, 1, 4 or 5. Then later Methodist and back and then go, hey, 1, 3 or 4. So then see and say maybe when them go, ministry go say, hey, but that other church people they don't come, don't give their own self don't come. But then demand necessary say, let there be coordination. Let them day. And let be an opportunity, since we get religious tolerance, let be an opportunity where then different players here they come together. Presently, we proprietors council chairperson are Baptist. So we never can say, oh, that next go be the next proprietors council chairperson. Maybe it go be Anglican, maybe it go be Methodist. So you find out, so then they are at that level, then they talk and all, because then they look at the healing ministry. And as much as then they touch people's life, preach the gospel and all of that, but yet the healing ministry, they still say for who, in as much as the one law is spread out more, if there is a need, that gap, let everybody left for the individual. Yes, we all get with different way for worships, but when it comes to health, let we all come together under one umbrella, where they call the Christian Health Association, where they coordinate. So that gap no go there. When it comes to issues, we want so number of staff. That umbrella organization, they go penetrate the Ministry of Health, say, out of we 43 member facilities, we get 5 we need so number of staff there. Or we get 10 where they grumble, say, they not get quarter for the staff there. Or we get 5 we get challenge for referral, they not get ambulance. So you find out so they go to one voice and then we move for pay attention to it. So that will be one of the reasons we make even the ministry deem necessary for work with Chasl, in as much as you don't see that coordination, say all that faith-based here, they under Christian Health Association. Let us sign an MOU, see how we go give them second men staff to them, people that we ministry already give pin codes, where then they attach to the faith base for work. Although most of the faith base, then one of the challenge we go get for good, they get more volunteers. because government not able to absorb all of them where we still dey in lobbying. So that na be one key gap. One, for let them be coordinated, who that go talk on them behalf, and who that go represent them in some other areas who side they're not able to reach us at that time, because you get some of the denomination we get more than 4 or 5 facilities. So them coming together, even get a health coordinator, because if you talk about the Catholics now inside Freetown, Catholic get about 4 facilities. So you get one coordinator, you know, say where they talk on behalf of all in 4 facilities. Likewise, if Baptist go to Napo talk, and they talk on behalf of all in facilities them. So their denominations, they will get 3, 4, 5. Then get one coordinator, health coordinator, where they talk on their behalf. So even it gets opportunity for in head of church appoint them for being member of the board. So you find out where they're at the board, because in our health coordinator, you know actually waiting in hospitals they go through, you know actually waiting in community they go through, you know actually waiting in staff then they go through, you know actually if they get infrastructure problem, you know actually waiting at the gap. So when it come at stable, you really know how for play the card.
That's a very good one. As thank you always say, a house divided by itself cannot stand. Now a very good gap una feel being together, una go able achieve more. Now that make una reach this far. They make you go far and una go able do more. So now, with all this good work, how we don't change the belief of working and working relationship in a community and institution, government and NGOs.
Yes, governments, NGOs, it don't create a great impact, because even presently the tour where we dey go, the testimonies where the staff then they give, and the evidence system what they see of Chasl logos in some of these facilities of waiting Chasl we don't do, and even the communities show say na evidence for say we for do more, or we don't do more way. Even if we donors they come at any time they go in any of them facilities, then they get things that we then go point at for say yes, Chasl lives here, because that's not one of the key thing. We even when we go around on supportive supervision, we ensure say Chasl lives here. We go to a particular facility, we not see anything about Chasl, that we know say something need for be done. So with the ministry, we they work well. We dey in most of them technical working group, we meetings then the day. Presently, Malaria began meetings, but because of this thought are not able for be part, that we did most of the technical working groups then, and the international NGOs or non-governmental NGOs also get your platform where we all they meet, where we deal with Slango or we deal with Moped, where we they meet together and see how for work well, even liaise well with the district health medical team, since the district health medical team and the different districts and are then at the eye of the Ministry of Health. So we they work well with them, and we member facilities them. They work with them. If one for penetrate any district, we go go first and sit down at the foot of the DHMT before we able for penetrate. Because start inside presently the project within Moyamba, because now 15 facilities we they do they, even though them facilities and they not to any of Chasl member facility, but now communities them what we they deal with. At the end of the day, the district health management team give we one of them district health sisters where now they help we for show the way. So it always there with the team, it always the lead. So it once they are involved, they are in it, now then now then know waiting at the issues, they give the support, and especially the community, because we use for say the healthcare workers go be transferred to another facility or wherever, but una way dey na una community na una get am. So una try for see how una go move una hospital go before, because you sick today something do you, before then they rush you go emergency or then they rush you go corner, you no go don jump police hospital. They must care you go there first for resuscitate you or do some things before they go. So community members, for example, in Nakinton, not go say because we not to police now, the aid man, the youth man, the Okada riders, the your aid man, whosoever aid man, they all for come together, identify the felt needs na police hospital. Say now this not the problem na police hospital. Oh go there na so many you want to, oh go there na so and so, then come together and you go see say it go work and it go be okay, because the police the way they government might transfer them na any other district, but the people then still say within the Kingdom community. So I think now that we work well with the NGOs and international NGOs, the Ministry of Health, and other SOYAT organizations there.
Yeah. Una they really they do a good work, because putting all of those together, it takes a lot, and kudos for that, for una good work. So recently we see una go out on a tour, one I mean called media tour. We go like for a very small thing, but what's that?
Yes, media tour, because as for the 50 years, I think one of the challenge where we identify now that Chasl don't do more and people know very little. So possibly because now the healing ministry where God Christ be they doing work, not be they take mic, they go and announce, maybe not that. But with him and SCC say, let we cause some positive noise, let people know the impact which also don't do the past 50 years and waiting intend for do more, and people will not know. You find out say people know more about CCSL, but then fail for realize say inside the compulsory CCSL, the Chasl na in did it again. Even though CCSL older for we 50 years, they don't on there, we don't 50. But yet Chasl still then at the same compound outside CCSL and they share the same gates. But people more you want for director, say Kandong Lodge, ask for CCSL. So don't begin make clear enough for say we don't change with signpost and all for that. Where you come for no say Christian Health Association Sierra Leone stay here and it in a 4B King Haman Road.
All right, thank you very much. And before we can go for a short music break, we'd like to know some of the experiences we una don't get with clinic and institution, like how it are like.
Clinic and institutions. So in continuity with the media tour, we got 43 health facilities. We just choose 7. We now the Western Urban and Western Rural. Yesterday we go na St. Anthony Clinic, where plenty people say not even know say St. Anthony they get a larger population where then they look at, and from the outside you think say not just a small place, but when you go inside you see the whole lot of work where then they do, and the nurses on duty we even attest to we say people then they able come beyond the catchment area. People they come on Waterloo and all for camp for services they, where that means say now how then they work. If they not be they work well, people no come out both far and near for camp. So we go there, we go Stella Maris na Juba, and we go na Methodist Church Sierra Leone Clinic where they also the same compound outside Chasl day. Today we don't go na the Adventist Hospital na Waterloo. We also go na Christ the King Hospital na Kisitong na Waterloo NJ, and the last 2 side way don't be appointed na the African Fellowship Christian Church Hospital, and also the Good Shepherd Hospice na McDonald we forgo. So with all of these one, it show the evidences of waiting the health workers don't they do na their area day, starting from maternal health. Then they give care to belle woman or belle woman who want get belle woman till he born, and after he born look after him pikin, and even give support to even other adults them. If even a condition where they not they deal with throughout, but then go give that first aid treatment and later refer you elsewhere. We go to now like the Adventists, where be very impressive. Oh, go today. You see, say they get blood bank. You see, say they get physiotherapy. You see, say they get X-ray department. Then even we even see say they get a center where they call the chapel, where possibly WHO say if you say you well, is a holistic something, physically, mentally, socially, spiritually. So if for let you determine say somebody well until you ask the person how you dey do, but you know they just see person outwardly and say he well. So some people with all medicine wey go take doctor go watch I say sick no dey know nothing, but if that person feel say mentally, or I for go na church, or I for go so, then create that kind of space there where you go you feel safe for commune with God, use Bible and pray and all of that. We see that one day. So then get all of this, then get a laboratory very functional. They able get side for somebody who go come up like and for deal with impatients and not able go, but it gets side the way you go say, well, at the rent inside and lodge and very secured. So we see all of them one in the likewise for Christ the King, where then self king, even just like Adventists, can get people them where they come out kind of Spanish doctors and all of that, take okay and do just free surgeries. So all of them thing there. So then with facilities here, don't do them with all the limited things them we then get. Even with the advent of the mpox, we recently do trainings for we staff them and also try for produce some infection prevention control measures or materials for them, from gloves, sanitizers, all of them things there will go be needed for help them in the work. Those are things that will be needed daily in all work. All go do because of the number of people them. So there are challenges, but these are the works they have been doing, and they do immunization, health talks, and they go out for follow-up on defaulters. Right now, most of them, even they out for going and give vaccine, this vaccine where they don't say don't come for girl picking them against cervical cancer and all of that.
That's a very good one, especially when it comes to mental health, where you talk about something being open place, because now people and they get people out because they will say you crazy, but you guys embracing people that if you feel like you want to pray, you are not sick, it's a very good one. And also the help owner, you guys are doing a good work. So family owner, don't forget you listen to Answer Folk Radio and online TV FM 100.5, and today we dey discuss Chasl at 50. And with me at the studio, again, Madam Gifty Florence Masakoy, we are the Executive Director of Chasl. So now we will go for a short music break, and we will come back, we will continue this cookie song.
Seen of streets alone, whosoever you day. Yesterday done dawn, and see the new day. You said it's alone, the 4G LCE network. Day now no free tongue, no need for swap SIM card. Just dial star 335 hash straight from your 4G device. Experience the best with QCell. Bright like the beautiful moon. It's not the way of 49. Yeah, QCell for me, QCell for you, QCell for y'all, QCell for me, QCell for y'all.
QCell, Salon Pride.
QCell for me, QCell for you, QCell for y'all, QCell for me, QCell for y'all. We want to make you know you can also get you see number on QCell. The newest code in town, 032. Yeah, QCell for me, QCell for you, QCell for y'all, QCell for me, QCell for y'all. Yeah, QCell for me, QCell for you, QCell for y'all, QCell for me, QCell for y'all.
QCell, Salon Pride.
Seen of streets alone, whosoever you day. Yesterday done dawn, and see the new day. QCell is alone.
We'll go check the pots for see if the water don't boil. And yes, the water don't boil. Now the cow has the rest. Come on, we'll put on a fire. May itself begin boil. So, Madam Gifty, as the water then the rest, we don't put the rest now and fire away the boil. Now this cook here. We would like for you to tell we some of the practical things we Chasl to do right now.
Yeah, some of the practical things we Chasl they do right now. One, the supportive supervision, because if we give facilities certain things them, we need for go round and see then they use them and all. And likewise, we donors themselves can come. Recently, two come. The key donor when I bred for the world, he come, and when he come, he even come and get training with not only even Chasl, but all the partner organizations and the auditors them way they can choose for audits than different organizations. So we get that because like last year we get a session on financial sustainability and resource mobilization. But this time around, they pay attention more on auditing because mostly people think when they say auditors, then they can't police you now. But when auditors come, and for look at waiting on a challenge or waiting a high priority on for work on, for strengthening on. So if any other donor want for come, you know, go scared for come for be partner to una. Then one. And the other one we ongoing, what we start recently, now what they get coordination meeting. Just as I say, where the faith leaders then be deemed necessary, say instead of them they individually let them come together. So likewise, we as the heart of the Chasl, the secretariat, we deem necessary for get meeting with all we member facilities. And when we begin get meeting with all we member facilities, the first one we take the podium and explain to them, because we don't do or we don't go do capacity assessment. So we read out to them, show them wetin really be come out of them. Whether they be they do well, whether they not be they do not too well, waiting at the challenges, and whether they be get best practice and all of them one day. The second one now we identify two of we member facilities where really share their own best practices. Who believe say others don't learn from them. One are before Freetown and the other one are before Mabesene, where they share the experiences, where they even they do something apart from them being nurses or doctors, as the case where they do into water production, they into agriculture and all that. Because in as much as we look at sustainability, the donors go tire. And every day then the ring and we say then go tire or then go wrap up, because when government change hands, it depends the next government we can waiting in priority. If you say priority not to health, then not to health, then definitely one way then the support for health will be a challenge. So now that make we get for fair ways and all of them one day. So in line with that one day as well, we don't count on the one that we go with 3 round, don't see the infrastructures them will be waiting in place, the triages. We are in somebody they go first, then get for assess you, waiting, do you waiting or do before then say no, you case urgent, or no, you wait first, no, you case not urgent. That's now another thing we count out. And also incinerators don't deal with them facilities, then we certain things that we they not need again, rather than we begin to wait them bottle them all, then get able get inside we then able for born then kind of batting in there. And also for them vaccines them. Some of the facilities that we they deal with vaccines them, we get refrigerator and IBC item as I say, and with all what we do, so we still not tap for the community engagement, because if they wanted the member facilities work well, the community for day at par with the member facilities, and no say now this support we need for give. So likewise, the community health workers are very key. Those in the community, now then they able for trace the fault and say, so belle woman then that also I say not go meet in 2 months, 3 months, they able for staff as a link with the hospital and with the community. So all that thing we don't day into them. And vocational training, we don't go on, we still they follow up on them. Some of the girls, them will be then at the slum areas, na bome, and then side and they don't do the addressing, they don't do catering, and all of them few trainings then of course we eye hospitals then they do the like Baptist, say people go come out from Liberia, Guinea, they still come from eye care and all of them one a day, do themselves challenge with lights and beddings and some other things there. Then also with medical supply unit, we can say some people say we're not a pharmacist where they sell medicine, they become rich. So what about we when our medics them or where they in well body business? If we work very hard, then we know say once we get quality drugs, that's going even add a plus again to member facilities, that then will be a go-to persons where then go always run go to. Just like if you look at now na Loreto, when you talk about epilepsy, say picking get epilepsy or somebody get epilepsy, know that when you go to Loreto, you go get the services there. Likewise, where Rainbow Initiative, they don't partner with you. We know say there are certain facilities will go be provided. We get them member facilities here where they go easily go there. In as much as we members then they give eye care, maternal and child health, and all of them things here. Yet there are other specifics they are doing. And one of the other key things where I think we don't do and where we wish for continue for do if we only get the support, because when we get unrestricted funds, meaning money where we can just use because now we go account for our real money, we can able do much. But when we have the one coming from the donor, it's challenging, because if you tell say na per mind for buy, na in for buy. But if there is any reason you have for change per mind for buy more fish, you get for the evidence is why you do that. And that will even create more credibility for let it could come next step. So scorecard training. Now something when we use go na the communities engage the actors then at the communities. For example, we go Senel. Senel will go there. We meet say one clinic be challenge that the midwife, because of they get problem with light, belle woman no can say attend to her. So when attend to the belle woman, Lord we say the woman no able for born for himself, he able say well I help her, la cut her. Then I go stitch am wey no get good light. Then so at the end of the day, self your eyesight and problem. So imagine that midwife they use phone light. So it's challenging. So situations like that, the hospital no fence, forget water, you go see Combra born, you go get for go fetch water, come and all of that. There was a need for what we call the community, the stakeholders, put them down, explain to them that these are the issues we don't come up. When una self can come. So then take the leaders them around the hospital, now then self-identify the problem. Oh, can can so, oh, can say, oh, can make so. Then we don't post so person na ya go in okay again because of be get side for the this that. Say okay, well these are all the problems. So how for solve them? Because not all of them problem will go tell government. How for solve them? So it'd be very interesting that they all come up with ideas. So with all the problem then, say okay, with all the 10, 15 problem on adoka, which one is really key? So it say do one we really key. They will not say and say okay, well if you don't say very serious now so and so it's the red card up. No watch nobody, so you they see the red card. If you okay, it's the yellow card. So at the end of the day, the thing that will be come up in red, will be really need attention. One will be really stand out. One, na be that light. Two, na be the fencing. Three, na forget water. Can you expect somebody don't born? They say let go fetch water. Decide where they get and all. So out of these three things, they ask them which one now pass all, and the key was the light. So how we go do one? Everybody, the one where they ride the bike or the youth man, now if I say well, I go give so amount, now the chief back say I go give. That same day they also it was less than 30 minutes. They raised the amount of money and go buy solar lights. So they started using it.
Yeah.
Then we got the other community where the compound so get so bush and all them, how they call the jama, wherein they come now water. So all that they engage the paramount chief and all of that. Then give we deadline. Another time we'll go, we call them come and say how far. So because now they own it, you just say everything they go on, everybody ID because I don't say money day.
Yeah.
So I use for tell person say put you more to say money day. When you put you more to say money day, it creates an impact. But if you just don't say everything is government, everything is church because na free, na challenge. So it's time that we get for change and be self-reliant and find something that will be sustainable.
And that na a very creative one way everybody they put in money because I go to watch out for make we do the right thing. You said they watch out, follow go do the right thing. And you guys following up, it's a good thing because we know how people can behave. Sometimes you go get and say do this and not do one. But it's a very good thing when I do for follow up. Say wait till we plan for do, it's being established. So now I know say Madam Florence, you said they smell the rest as the well na fire. And we listeners there, we una thank you because we know say una dey blow the fire, they feel the heat na the rest they boil sober one. So right now, Madam Florence, as the rest they boil na the fire, we go like follow you tell we the kind supply the una can do, what una can supply, and waiting are some of the service the una can offer.
Yes, so some of the supplies, one as I say earlier on, most of the key things they what they do now supplies them we come in from donors or partners. Presently, we get so that they can call say, hey, we get so drug or one get or get so thing what we want to. So they can come through we go through the documents and see waiting applicable because there are times even some donors go and give something. But we dey in the position for say yes or no. Because let's say, for example, you want to send motorcar to or some equipment. Where if that equipment spoil, you not get the technical person for maker. I will not say yes to want that because at the end of the day, it can have more burden to we.
Yeah.
So we get all of them things then we look into. Presently, we get a group known as Hope and Healing. If everything work well, they try for say how they go help you forget certain things. Where at the end of the day, if you come, we know so member facilities go enjoy. And at times, if some of them things then they come, if we member facilities then get them enough. Then we extend an olive branch to the ministry, just like when they read in classes they come. We extend an olive branch to the I departments, not the Ministry of Health, because we and them don't they work together. As I say, we continuously go on supervision, we do community engagement, we do this scorecard training where we dey engage communities for let them actually know how dem sef for chip in for support their own hospital or their own clinic, because na dey dem dey at that time. IBC materials dem, coordination meetings, meeting with partners, lobbying, advocacy. So just the 4 pillars wey we dey work with when we strategic plan, the health system strengthening. We dey try for strengthen the health system. E no easy, but we dey try with the little wey we get and with the support and the talk wey dey pan. Then also network unity, whether that be the idea of the church leaders them, but let we bring all we network together, let them be as one. So if Methodists get any better, if we extend Olive Branch to Baptist, or if Baptists get any better, if we extend Olive Branch to Catholic, so we get our network unity. Then evidence advocacy. If you no get evidence, you no dey able go big. So if I for talk na they say we need so number na because we don't go out.
Okay.
Say so facility, do you have they need blood pressure machine, they need Doppler, like yesterday we go Stella Maris. Then tell we say they need more, they need Doppler, they need blood pressure machine. If people then get why must be say they need more because of the number of people then whether they serve na Juba na God reach as the case may be. So evidence-based advocacy, so now that make member facilities that we always then at the neck for say una send we data. Because if we want get any evidence, anybody who they beg, they ask we for data. Almost now the people they will now the cover. Waiting at the need. How comes you say this facility then get more hypertension, then get more diabetes? Now by the evidence.
Yeah.
Or why make you say them people are then get eye problem? Now by the evidence. So data very, very good. So we need data because that data now they help we for make advocacy or for go bigger or for go lobby. Then institutional capacity. You can't give what you don't have.
Yeah.
So amidst all of this, the secretariat stand firm for help with trainings. We don't do training there recently on pharmacy. We don't do training on the one way they deal with drugs, because at times it can be said the drug good,
Yeah.
but it depends how then they keep am.
Yeah.
The drug will lost in potency. So we get all of them things there. So we not just few of them we don't do. So we dey continue for expand access to care, we dey improve with community care, and also we dey strengthen with partnership, and we also dey try for sustain with services during crisis, the mpox.
How often I can do them supply? Is it monthly, quarterly, or based on request?
Mostly based on request and how we get am. Because we warehouse not that too big, so if we get started say like now you find out say in few times from now, because I say some of the things that we they come na through donors, and as donor they send they tell you waiting for do. You get straight jackets, except otherwise you tell and say no, I think say because of this situation. You go tell say if na glasses every 3 months na this number una for distribute.
Yeah.
Every so month na this. So like the mpox where it become in a be emergency. So as it comes straight up, we go into distribution.
Yeah.
As it comes straight, we go into training. Because of how we write and say the cases then they rise. These are the
Yeah.
evidences. Go na the National Public Health Agency then platform. You go see the result. How many man affected for the day, how many woman, who that then they where don't they recover, who that don't die. So they see the evidences. So you find out where mpox can they say, let we do so and so time. So it was like that. So it depends. But whatever we get, as soon as it's available, we inform with facilities since we get a platform where they're all day and reach out to them.
Well, this is not a very good one. Family, they will not forget to listen to Answer of Hope Radio, FM 100.5, and online TV. And with the cook now, what to do. Now we card the jakato for the soup. As we rest, they're almost ready. They don't boil down and they try for steam now. Madam Josephine, working with health facility across the community and you support all one another get to an institution consistently, we know say not possible without challenges. So you go like tell me some of the challenges where the organization currently they face as due to the work in health facilities and with the government.
Yes, the challenges then plenty. Amidst all the good things there where I don't say for more don't get triage, we they get duty waiver from government. Government they give you staff there on secondments, and we don't help with facilities in some of them here where they still in community engagement, still they engage with church or faith leaders them for me they're able for help out. Yes, there are challenges. One of the key challenges I say na funding. Because most of wetin dey come in na restricted fund. And because na restricted, as I say, na straight jacket, wetin tell you for do, na you for do. If dem not tell you say na for buy motor car, na for buy fuel, you no get for do am. Na wetin the money come for that purpose. Because at the end of any project, or even according to how dem time, and maybe some project go tell you say every 6 months or every 3 months, dem get for can do auditing. So whatever dem come wey you be don sign, na that agreement say na you don sign, you go contrary to, I go be challenged, not for now, but it go tell on una audit report, or even later go affect una institutional report where if any other donor wan come, e wan look at wetin una do previous year before ever they look at the present year. So funding na one challenge. Although with we unrestricted fund, we get a hall, though e no get too much capacity, but at most go take up to 60 participants if you get workshop or any session where they take up to that number of people that day, where they now for King Hammond Road, where you can come in for rental. Through that, we can able get we unrestricted fund, because not all we staff them donors they pay. You get certain staff them we donor they pay. You get certain staff them where the secretariat employ, because we need them for do certain work for the secretariat in up and reach to outside. So funding now one challenge we get. So we extend this to the one way they listen, the viewers, listeners, families, individuals, we get passion for well-body ministry, for let you extend olive branch to the Christian Health Association, either through you faith actor, we go see. It might not be say you want come directly to Chasl, but you can decide for adopt a hospital where they under the faith base. That could be very good for we. You can say the Anglican and get the facility in a Kangaon. You can say na Moyamba Ikomo you want give support to Kangaon. That's well and good. Or the women's the steward them, or sidesmen, sideswomen, as the different organizations they name them, then different denominations them can come together and say we want to do so and so for that particular hospital day. They go a long way, because Anglican and get your Methodist and get your so na identify una communities they wanna get. UMC get so much. Then get a Yoni Banner and all of that. The Catholics then get a Lady of Guadalupe. Then get handmade na Penembu. All of them one day. So if we come together, even St. Anthony Clinic, Stella Maris, MCSL na yaso. You get the Methodist Hall and that clinic. They what if somebody go you get attacked? They want one go today. And go find where you go safely. You feel good for let them lay you. So another challenge all facilities then they face na light. Some they use the solar, but it's challenging. Don't na underserved communities though, but at least if na standby generator of solar, we go able for sustain them for hours, because most of them they run the 24 hours around the clock on duty. So lights na one, because if you not see where they go be challenged, you go chuk that person say for fan in vain. Then the toilet facilities as well, because you not go down well, you go once the wash system no okay, water and sanitation and hygiene no okay, you dey go carry more problem. Diarrheal diseases as the case may be. So that's now another challenge we they go through. Then also drug stockouts. We facilities then can stock out of drugs because of the distance. So no wonder anytime if we get opportunity for travel go any side, we go with them. If we get any consignment for them, or similar, we can ask them if any of una get opportunity for canton, una make loan, so if una get anything at the store, we go make it available for una for go, because of stock out and not finally it is. So we still ministry don't they help and free healthcare, whatever we self care we can give, but it's not everything that is available. So you will get any opportunity for law, we get quality drugs for support to member facilities there. You and then any of them church, you get people then over so you can support any of the member facilities here. Now an opportunity for let you go through your bishop or your reverend or your pastor for let you give this support here. So then also workforce challenge. In as much as the ministry they give it pin coded staff, yet they still not do. Because if you get 12 staff now one facility, let we say now 4 per shift. That 4 per shift, let's say 1 they get off. So now 3 they work. Let's say the workload, you get lab, you get maternity. In maternity, now if you go meet woman where they born, you don't expect 1 person for deliver. So that 3 staff not they do. Or let's say that 3 staff wait for the on duty that day, 1 fall sick. It's possible. So 2 for the. So we still get gap for staff them, and also how for help we for some of them when are volunteers for let them be absorbed. At first ministry from the first MOU we get quota where then go give to the Christian Health Association, but recently every day with the upgrade technology and all now online and they apply and all, but we there in that constant communication for see how the ministry go help in line with we volunteers, and what if they apply but wetin go show as evidence say these people have served as volunteers in so and so institution for so and so number of years, wey go make possibly dem get concession. Then we don promise for look at that, maybe they will ask for a written explanation or recommendation letter as the case may be, because dem be used for don dey give it. So na workforce challenge that one day. Then also vehicles. Some of we facility no get ambulance. In case of emergency, pass dem go get for wait for the DHMT. So imagine you get for call first, let's say Kamakwe now. You get for call first for the ambulance go inside and all. That road alone no more for. So going and coming, if something happens, you say because of delay in coming to the hospital, na delay in arrival of the ambulance. So if we get functional, there are times some facilities like the last go Serabu get motor wey Chasl be give pack the either day, but it's non-functional. So we need functional vehicles. So you will not say you get any motor car where you go help, especially the land cruiser them, because then they go the length and breadth of them bad go there, and Chasl don't they go now them communities the way they go there really bad. Well, especially during these rains. Recently we don't go do supervision at Serabo. The motor car 10 a day garage. So we get all of them things there. So we need more vehicles for help the secretariat for go out. And also remember facilities themselves need helping hand for the ambulance, for improve on the infrastructure, the lighting system, the wash system, the drugs, and even volunteers them wey go dey come over see the car Christ the King get, Baptist I King get, wey visit on the car and they go around. This way then self can then see, then can able for give a helping hand. Then you self when a medical person, you self can give and all the branch to the member facilities. If I told you not be ever no say you denomination gets facility like that, try and find out and no say we get a whole lot of them where they right around inside Freetown. Now the 13 district with the exception of Pujeung, Falaba and Kenema, but all the districts, all the 13 districts apart from them 3 then they out of the 16 and 13 district and the Christian Health Association gets member health facilities.
Indeed, for every challenge, there's a solution. I know say God will make the solution for these challenges and it will be better in the future. So now not forget, listeners, you do listen to Answer Folk Radio, the voice of the people. So the cook, it almost done right now. For cancer no more now. We don't put the pepper, we don't cut the plazas, we don't put an all we don't now. We're ready for cancer van. So Madam Florence, in 1 minute, waiting at your final word on Chasl at 50, and waiting you imagine the next 50 years will look like at Chasl.
Thank you very much. My final word now that I'm alone and no say Chasl don't give compassionate care, and don't create impact na Sierra Leone, and we still the plan for go beyond and hope say member health facilities, the church actors then go decide for let them see the need for build more. The one way in a clinic for maybe upgrade to hospitals, the one way in hospitals for maybe upgrade to other different things, just like as we go advantages or then the thing forget dental wing and all. For now we upgrade to more, so go be more relevant, more credible. Now decide them what we deserve. And we go want for see Chasl in the next 10, 15, 25, 100 years for it be the as in as much as we dey between 30 to 35% now they cover government, give support to government in serving these different areas. One see how we go up to 50, 55, 60% in we outreach, and now go deeply involved into community engagement, and now we go be deeply involved where the churches themselves go give it time for the go now the church then talk to them parishioners there or talk to the church members there, because maybe we'll go face to face, 1-to-1 we talk to them, then go see the reality foresee Uda will come up as a family, as an individual, as an organization for support the Christian Health Association. Members say we want for continue for expand, we care, we want for continue for improve community care, we want for continue for strengthen partnership, we want for continue for empower the young one them, the Kumbra them, the Pehmahun them. We also want for continue for sustain with services them, whether in crisis or no crisis. And we also want for continue for strengthen with health system. We want for maintain network unity. Even Muslims them will not get problem, because in the communities where the Muslim they will not get problem. They work with everybody. That's one good thing about Sierra Leone. Even though we carry the name Christian Health Association, we don't get situations where they get meetings and all, where we want to look at the uptake of fertility awareness, where the fact actors them, both Muslim and Christian, they actively come on board. We still want to see how evidence advocacy go a long way by collecting data, give accurate data, we're very meaningful, and continue for do institutional capacity for we member health facilities and for we serve at the secretariat.
Thank you very much, Madam Gifty Florence Massakoy, for joining me at the Pehmahun Cook today. As una can see, we don't cook done. Una thank you for blow the fire with the comments then, because today we see more pressure, and una not stop for the blow the fire for we, because if una not been doing, una been for able to cook done quick, una thank you. And also, una will listen to we the tell una boku thank you for staying with we. And me, I've been the chief cook for today for the past 1 hour. So join me back next week on Thursday, same time on Answer Folk Radio, as we will talk about issues we matter. And also, thank you to the producer, Anol Kintu, the man behind the camera, Denzo, and we station engineer, Jonah Ganea, and we executive producer, Madam Maria Makaifona. I have been your host, Lamsi John. Until then, stay blessed, stay informed, and remember, Pehmahun no dey done. Madam Florence. Oh, wait, now, Madam Florence. Madam Florence, we're done. Now we don't do. Nice.